what is the salary packages that army offers you, and what are the perks along with it?
Yes, so there are numerous benefits. Apart from the basic salary, for a captain, I would say must be around in between 1 to 1.5 to start with, and along with the excellent perks.
What is the maximum post, position, and the salary?
As a short service, you can get up to 2.5 to 3 for sure. And especially if you are a specialist, certainly, along with the excellent perks of getting health benefits. There are a lot of canteen benefits. Then there is transport allowance, uniform allowance, and there is insurance. Plus, there is free education for the kids. So there is an endless list, ma'am, and free ration.
What is the position in which a BDS would join, and what is the position in which you joined, and where are you now?
So I joined as a captain. Everyone joins as a captain. So I had a seniority of 3.5 years. Reason being, I did my 6 months of JRship. I did my 3 years of PG.
Right.
So I was promoted to the rank of major in the very next year. Whereas if you are joined as a BDS, then for 4.5 years you remain as a captain.
Right.
And then for the next 7 years you remain a major. Thereafter you get promoted to a lieutenant colonel, which I am about to become. Basically, this is the order in which you join.
In a very, very special episode of Pathfinders in Dentistry, today I have with me my friend, my colleague, my junior, Dr. Saurabh Arya. Before I introduce Dr. Saurabh more, a heartiest welcome, Dr. Saurabh, and thank you for finding time and joining us for this session.
Thank you so much, ma'am. It's a pleasure to join you. We have been following your footsteps right back in 2011-12. We have read your books, and it's always a pleasure to join you, ma'am.
Thank you. Thank you, Saurabh. So, Saurabh is a maxillofacial surgeon by profession, but not just that, he is a very high ranked official in the Armed Forces of India. Dr. Saurabh has done his BDS from Himachal Pradesh. He's done his MDS from HP Government Dental College, Shimla. After that, between that, he was a junior resident at Maulana Azad, where we first met. And after his post graduation from Shimla, Dr. Saurabh was a senior resident in CMC Ludhiana. But then he gave his AIPG NEET again and joined the army in the Short Service Commission. 8 years into the army, serving as an army official, as a maxillofacial surgeon, today we are going to have a great conversation and a lot of questions to Dr. Saurabh. So, Saurabh, why don't you tell us about yourself a little more, about your family, about your life?
Absolutely, ma'am. So I am a maxillofacial surgeon by profession, and I accidentally happened to join the armed forces while I was doing my senior residency at CMC Ludhiana. So I don't have any family background of the armed forces, but yes, I can say it's a very prestigious organization and full of adventure with postings in rough terrains and counterinsurgency areas and everywhere one can even think of or imagine. So, and about myself, I never had that idea in my mind that I would ever be in the armed forces, but as luck would have it, right now I'm here. And I would say it's one of the very prestigious organization and a very good job for any dental graduate or postgraduate to join.
That's great, Dr. Saurabh. So, is your spouse, your family also, like you said, you had no parents or no history in the army, but currently, are both of you in the army or just you?
Yes, so my wife is a pathologist, and she is also with me in a spouse posting. So I got married after joining the armed forces.
Okay.
So both of us were in the armed forces. So postings could be coordinated well. So then thereafter the journey began.
All right. Okay. So, we will start from the scratch, Dr. Saurabh. What was the selection process? So, you can enter into the army after BDS through the same NEET exam, and you can enter after MDS also through the same NEET
Yes.
exam, right? So, how is it different? How is the selection? Is the selection of an MDS easier over a BDS student, or is it the other way around? What is the selection process exactly?
Ma'am, the selection is through the NEET exam, as we all know. So I had never given an entrance or any interviews in armed forces, but until when we found out that the armed forces are taking the candidates through NEET. So I decided to give NEET because that's what we are good in, right? We all work through for a government seat by solving MCQs. So we all eventually get into the habit of solving MCQs. So the NEET exam happened. I cleared that. So any dental graduate or postgraduate who wants to join the armed forces has to first clear the NEET exam.
Right.
So let you have an option of ticking it in the INICT form while you fill it online. You can put a click on the AD core option, and thereafter you will automatically be called in. So like if there are 30 vacancies, the candidates can be called 5 times, 6 times. So top 180 candidates can be called in for the interview. So the first leg of the examination is the NEET exam. The second is the interview, and then comes your physical fitness. So it's very
Right.
important to know that physical fitness is extremely important in the armed forces, because you are posted to glacier, you are posted to high altitudes, you are posted to counterinsurgency areas where both mental and physical fitness really matter, and they judge you in that regard, ma'am.
Right. So fitness, like you said, is very, very important. So anybody who is unfit should not try itself, and so that last stage पे जाके ना उनका cancellation हो, पहले either they
No,
should make themselves fit.
anybody who is not fit should work on his fitness, and simultaneously
Absolutely
try
right.
also. One has to
Correct.
be
That
fit.
makes more
So,
sense. So what
you cannot
inspired you? Yeah. Yeah. Sorry.
you cannot leave out some congenital diseases. Sometimes after the interview, you are, because you undergo all the tests, you undergo ultrasound, you're thoroughly examined from top to bottom, so you cannot rule out some congenital, something in the eye, some genetic disorder in the eye, that you cannot.
Which you are not aware of, but they will screen it and
Yeah,
they will
they will.
probably tell you at 25
So
years of age, 30 years of age.
So 1% is luck for sure, I would say. Like, ma'am, it happens in every entrance. You know it. You know better. You
Yes.
have cracked
Yes.
all the entrances in India, so you know it better. 1%, you have worked very hard, 99.9, but 0.1% is that prayer factor, I would say.
Right. Right. That makes sense. So, what inspired you to join army? Saurabh, because you were already a maxillofacial surgeon doing senior residency from a very good institute. You had a lot of options. You had academic options, you had clinic options, you had consultations wala options. What inspired you to join the army and give the NEET again?
Yes. So first of all, the inspiring factor was more of the uniform, which I really like till date, and I'm sure no one in the armed forces can deny the beauty of the uniform and the respect, the work life balance that it gives. Yeah, of course,
Right.
every government job has its pros and cons, but this prestigious and beautiful organization bestows you with a lot of blessings, and there are like unlimited good points about this organization. So
Perks.
yeah, absolutely. So a lot of people from, in fact, after I completed my post graduation, we have the habit, who are all of us who are from middle class families, to give all the
Right.
exams, and the selection in the armed forces is very fair and square these days through the NEET. So I happened to give all the exams. I like wrote into senior residency exams. So you qualify, some you qualify in the written, you fail in the interview. In this, somehow, luckily, I clicked through all three. So the written
Right.
interview and the physical examination as well. So I would say a lot of people at that time when I had joined from AIMS pass out, were serving in the armed forces. That did inspire me, one, and second, the uniform. And my first posting was to Srinagar, which is a counterinsurgency area where you get a lot of gunshot patients.
Right.
So I had a lot of fascination uh, 8 years back,
Performing these cases.
absolutely, to serve in and do my best for the organization, ma'am.
Right. So is it like, this is a little biased question because you're an oral surgeon? Is it because of your branch, which is oral surgery, that you were posted in the areas closer to the field and in the areas closer to the war struck
So the
regions?
posting policies, they are same to all. They are very fair and square.
Okay.
Every candidate will get a field posting. Every candidate will get a piece posting. So um,
Right.
it's everything is documented. So
Okay.
it's not that me being oral surgeon is posted there. Any dental graduate will also be posted there. Anyone can be posted. So
Right. Whether it's a prosthodontist or a periodontist, you will have to be serving in all the regions, not just the oral surgeon.
yes, ma'am.
All right. So when you joined, I mean, you were a postgraduate and a BDS candidate who joins. I mean, there are different stages, there are different levels in the army. You start as a captain, then you kind of get promoted and all. What is the position in which a BDS would join, and what is the position in which you joined, and where are you now?
So I joined as a captain. Everyone joins as a captain. And firstly,
Okay.
I'll just get back to the question you asked previously, ma'am, whether a dental graduate has a more chances of getting selected or a postgraduate. So I'll answer that.
Yeah.
In my opinion, have that a dental graduate has more chances to qualify. Reason being, because the
Okay.
armed forces has to fill its PG seats in RNR and AFMC. So
Right.
the seats
Right.
can be filled by the dental graduates. So they have 100%. They have more chances to qualify as opposed to a postgraduate, because post graduation is already going on in the army, so they rather require to fill
Right.
those. So that is one, number one. The
It's a
second
very
question.
important point.
Yeah, so that's a very good thing for the dental graduates. They can actually join, and they can think of getting a prosperous career in terms of getting a postgraduate seat of their choice in very prestigious institutes like RNR and AFMC. So that was,
Definitely. And the
yes, ma'am.
army will make you do PG. They will still give you a salary which will be much more than the stipend that you get from any government college. So that's a very big
Absolutely,
perk, I think.
absolutely.
Right. Okay. So and you join as a captain, both as a BDS
Yeah,
and an
so
NDS?
coming to that, you join as a captain. So I had a ante-date seniority of 3.5 years. Reason being, I did my 6 months of JR-ship. I did my 3 years of PG.
Right.
So I was promoted to the rank of major in the very next year. Whereas if you are joined as a BDS, then for 4.5 years you remain as a captain, and
Right.
then yes, for the next 7 years you remain a major. So then thereafter you get promoted to a lieutenant colonel, which I'm about to become. So basically, this is the order in which you join.
All right. So you will be a lieutenant colonel very soon, it seems, because you're already a major there for last 7 years.
Yes, ma'am, absolutely. So I am just in a month's time or 2 months' time, I'll be promoted to lieutenant colonel.
Right. So I can't tell you how proud I am, Major Saab, talking to you right now. Having worked with you in MAMC as a colleague and as a probably junior friend, and now I'm seeing you doing so well there in the army and serving the nation. It's really inspiring, and I'm sure everybody, all the BDS graduates, you've told a very important point that they have a better chance of selection because then they'll have to fill their
Absolutely,
PG seats. So it's a very good
absolutely.
opportunity for all the BDS
And
graduates.
also a quick word about DBMCI. It was being away from home and being away from social media. I have never got a chance to see the DBMCI team. I was really thrilled to see Dr. Ashwarya Kaushik, Dr. Kunal. These people I have worked with so closely with Dr. Kunal, and I would like to congratulate you, ma'am, for building such a good team. It can really be of great help to the graduates to get their dream job and a branch of their choice.
Thank you. Thank you so much, Saurav. Uh, okay, if I may go to the next question, like you've done your MDS also from a very prestigious government college. What kind of clinical exposure do you feel is different? Is it the same or is it more in the armed forces compared to an institute like a GDC Shimla?
Ma'am, that's a very good question. Just see that as a postgraduate, as a maxillofacial surgeon, or let's say as a prostho or a endo, you are getting posted to different areas, and a doctor in the armed forces is taking care of the serving personals, their dependents, and um, their spouses. So
Right,
you are like, I was in at one point of time, I was down high up in the north, and the next posting was in down south. So the kind of exposure here is very, very, very varied, and you get to
right,
see a lot of cases. And
right.
the patient flow here is very high in every surgery, I would say.
Right. I'm sure, Dr. Saurav. We used to celebrate when we used to take out one gun bullet from the frontal bone, and I'm sure you must have done hundreds of such cases, and it must be really, really thrilling, the kind of
Not, if
exposure.
not hundreds, yes, quite a good number of cases. You get a lot of exposure going here and there. So that is
Yeah.
the biggest asset. Like I serve, and this is a tri forces. Like you can be posted in Air Force, Navy, or Army. So like I was in my first posting, I was in the armed forces, and then the next posting I was in Navy. So
Okay.
I actually was on the ship. So there are these jobs. They are challenging mentally and physically for sure, but at the same time they are very rewarding for someone who is fond of adventure also.
Right. It's thrilling. It sounds so thrilling already.
Absolutely.
Yes. So that brings me to my next question, Dr. Saurav, that transferability in job is said to be a problem for the doctors, because any doctor, they say, he needs to settle down in one place, whereas the armed forces, it is thrilling, like you said, and it is very, it's adventurous. But do you feel that, this is one thing which keeps a lot of people from not joining the army, because it's a transferable job and it's a 14-year period. So especially women, just the girls who feel that, I would be transferred from one place to another, whether I would be settled properly or not. What do you have to say about it?
So there is no gender bias. I mean, you can, any girl or any boy, he or she can actually sort of resonate with the army principles very well anywhere. So it's nothing like that. But yeah, you got to see your home circumstances as well, your aging parents, your small kid. So all those things should play in your mind, you know. But having said that, things can be adjusted, and there are various options of getting compassionate postings or spouse squad postings, you know. So you can apply for those, and the directorate is pretty considerate in that regard too.
If the
So that
both
was,
the both the husband and the wife are in the army, then they would give you a posting together.
there are certain policies are there. So
Okay.
um, that may or may not work in your favor, but yeah, you just give it a try. That is
Right.
what I can say.
Okay. All right. And what about girls, Dr. Saurav? Is it safe? Because, uh,
Absolutely safe, ma'am. Our present DGMS is a lady. People are
right.
of the rank of lieutenant general.
Yes.
No, they are there. So you cannot say a lady can really actually do very well, and she can fly very high in the organization. And
Right.
there's no dearth of getting a prosperous career. So you can actually do very well.
All right. So all the girls who are listening to Dr. Sarah right now, you can either find a husband in the army, or you can find a husband who can work from home, do a corporate kind of a job, and move with you from one city to another for this very, very exciting role that Dr. Saurav is telling about. So, if you don't mind me asking, Dr. Saurav, they say never ask a man's wage. But, honestly speaking, 14 years is not a short time. Being in the army and serving there as a captain or a major or a lieutenant colonel. What is the salary packages that army offers you, and what are the perks along with it?
Yes, so there are, you know, numerous benefits apart from the basic salary. For a captain, I would say it must be around in between 1 to 1.5 to start with,
Okay.
and along with the excellent perks of getting health benefits, there are a lot of canteen benefits. Then there is transport allowance, uniform allowance, and there is insurance. Plus, there is free education for the kids. So there is an endless list, ma'am, and free ration. So a lot of things are there. You just cannot single out. The armed forces is doing its best for the serving doctors or the serving personals in the
Right.
in such premises. I would say, ma'am.
Right. And what is the maximum salary that a short service candidate can reach up to? What is the maximum post position and the salary?
As a short service, you can actually get up to 2.5 to 3 for sure, and
Okay.
especially if you are a specialist, certainly. So there's no, and plus there are so many perks, you know. You just cannot count your salary in terms of the money that you
Your salary is actually your saving, right? It's everything else is taken care of.
have.
Right. All right. So, apart from these salaries and perks, what are the other growth opportunities in the armed forces? Foreign trips and any
So there are,
fellowships.
absolutely, there are UN, there are these UN mission vacancies in which they post you abroad. So you have plenty of opportunities. You know, you can be posted where the salaries they become double and tax free. Like you get a posting in Bhutan, you get posting to Congo, Lebanon, and Maldives in Navy. So even for that matter, some infantry officers they get posted to US. So there are a lot of opportunities. It's not that the armed forces is going to stick you around in. So you got to grab the opportunity and excel. That is what I would like to say here.
Right. So a lot of growth options there in the army.
Absolutely.
And so another question that comes a lot of times in our students' minds is how much army or armed forces jobs are you supposed to do? I mean, apart from the doctor jobs that you do, are you also expected to do some military kind of things for the during
Yeah,
certain
we are trained.
situations?
Yes, we are trained for the with the weapon training is there for sure. There's a three
Okay.
months military officers basic course that we have to undergo as a
Okay.
dental surgeon in Lucknow. So there we are taught various weapon training is there, and there are a lot of activities like you have to do a timed run, like you have to run 5 kilometers in 25 to 30 minutes, and all those things are there which you have to do. So that's basically fun, I would say, and I thoroughly enjoyed it. There's nothing bad in that. And
Yeah.
once you are back after your military officers basic course, you are definitely, apart from being a dental surgeon, you are roped into administrative duties as well. This point I would like to mention. So
Okay.
you have to do some few basic administrative duties, like there's a lot of paperwork which you have to do.
Okay.
So that you have to even like managing the medical stores, equipment, sophisticated equipment, all those things are there which you have to do. It's part of the duty.
All right. It's like managing your own clinic also. Sometimes you need to do
Yeah.
a lot of take
Like you are
caring.
your own manager in the dental clinic, or you can
Right.
hire an administrator, but here you cannot hire, you have to do both the jobs.
Right. Okay. So some administrative work, some military training is a part of the uh,
Yeah, absolutely.
14
Curriculum.
years period. And you always would pray that you would never have to use those weapons in actuality. Uh, how
Yeah.
often, how rare or how often is it that you have to actually use them?
Whole open training happens like once you learn the training in your military officers basic course, then it is a routine thing.
Okay.
You keep on. There is a practice which keeps on going in the cantonment. So you have to do it every.
Right.
You have
So
to do a
just so
timed
that you're
run.
prepared.
Yeah, you have to do a timed run, which is, and you have to do short runs. You have to do sprints. They are part of the this thing.
Right. Right. All right. Okay. Tell us a little about the permanent commission. If somebody wants to be a part of the army all his life, what is the method of going about it?
Yeah, that's again very fair and square. So once you complete your 2 years of uh, your commission job, then uh, there is a advertisement for the dentistry. There are around 12 to 13 seats. It really varies. So for that you can apply. So again, there is a exam for it, which is again very basic exam
All
which
right.
happens, and along with that, your confidential reports which go every year. Um, so the marks have to be good in that. So both these combination of things, if it is good, then you have a very good chance to make it to the permanent commission. Yeah,
All right.
seats are less for sure, but again, you can do it if you have a good confidential report and you do well in the interview.
Right. Okay. Okay. So it's in the end of the 2 years that you have to decide whether you want to be a part of the permanent commission or not.
Yes, yes.
All right. Okay. Okay. I think lot of great answers there, Dr. Saurav. I'm sure a lot of our students are inspired with your journey, and a lot of my curiosities are quenched here after talking with you. Thank you so much.
Thank you.
Any
Thank
any
you.
message that you want to give to our students?
So you must, all of you must try and appear for this wonderful organization. Be a part of it and try to excel in this organization in every possible way. And in India, you have MCQs, so grab them and get a hold on those MCQs, crack the NEET, and then really the path is much simpler, I would say.
All right. Okay, sort of controversial question नहीं पूछूंगी.
Uh,
Toxicity in the army and all of that हर जगह होती है थोड़ी बहुत, but If you want to answer that, you are welcome to answer.
Toxicity, it really depends on you whether you want to take it or no,
Right,
and it depends on the individual. Some really don't care. They just do their work, go back home.
right,
And toxicity is everywhere, as you rightly said. You gave the answer. This It's everywhere. So you just have to ignore it. Is what my principle is. Just go there, do do the hands-on, do all the work, do all the patient work, make the
right,
patients feel happy, get back home. There is no dearth of patients. There are around
right,
40 to 50 patients, is
right,
what I see in my OPD, because the OPD services are free of cost. Everything is
right.
free of cost in armed forces. So there's no dearth of patient work. So just do the patient work, get back home. So otherwise, yeah, everywhere toxicity is there for sure.
All right. Okay. Thank you so much for answering that little bit also. And
Um,
thank you so much for your time, Dr. Saurav. We hope whatever you want after these 14 years of service in the army, you get that in the best possible way.
Thank you so much, ma'am, for inviting me. I'm really grateful to you for inviting me, ma'am.